Well, we go back to this story with Professor Koleka Mlisana, who's the newly appointed co-chair of the Ministerial Advisory Committee on COVID-19 that has been set up by the minister. Professor Mlisana has been an active HIV/AIDS researcher, and she joins us now. Prof, again, good morning and welcome to the show. I started off by congratulating you a bit earlier on, and I was asking whether you feel as though you've walked into a storm, considering that there are these fears of a third wave, but on the other end as well, there's also this pressure that may come from the Easter weekend starting next weekend.
Okay, no, thank you very much, Algin, and I'm sorry, for earlier on. But as I was saying, is that really I don't feel one is getting into, there's a looming storm ahead, because there's been great work that has been done by the Ministerial Advisory Committee, and Professor Abdool Karim has really done a sterling job. So for me, one is really just getting to see what is currently happening. What, for instance, you talk about the coming, Easter weekend. Remember that, I'm joining in when the MAC had already presented an advisory to government. So now we're just waiting to hear what government is going to say, whether they're going to take it as is or they will tweak it a little bit. But the most important thing, really, as Prof Abdool Karim mentioned earlier, is just to make sure that we truly try as much as we can to prevent any large gatherings that might actually trigger, the infections. And so it's going to be important that we really adhere to whatever restrictions that government is going to come up with. I know we're facing the Easter weekend, not, within a few days. And so it's going to be important to stick to whatever numbers that government is going to give to us, because remember, where there are huge gatherings, that's where then the super spreader events, we really are creating that, and we want to avoid that. And for me is to say, whether it's within places of worship, it's going to be within malls, is partying. Actually, there shouldn't be any partying going on, because we really just don't want to trigger the third wave. And more importantly, at individual level, ensuring you are socially distanced, ensuring you are wearing your mask all the time, and you're washing your hands and sanitizing. So that's going to be critical and important as we face the oncoming weekends.
Do you mind telling us, Prof, what it is that the MAC has shared with the President in terms of the recommendations? Understand that there's a meeting that the President will be having with the various premiers on Monday.
Yeah, no, I'm not able to share that with you. As I say, actually it was before my time, and I think that has been forwarded to the minister.
Okay, so you're not able to share that. But from your personal view, though, do you think that there is a need for stricter restrictions, considering that we are moving into the Easter weekend?
Yes, definitely. There's a definite need, for the same reasons that we were stating, that really, remember, whenever there are long weekends, that's where people then tend to, congregate in large groups. People go to the beach and do whatever sorts of things, and families come together, and there may actually be events happening. So we need to make sure that we really adhere to whatever restrictions are put ahead. And in fact, even whether it's taxes or whatever, we really cannot afford not to adhere to the restrictions. And it's important for those restrictions to come through so that we really don't trigger the third wave.
Mm-hmm. Do you know when the announcement will come around those restrictions? If possible, there would be those restrictions?
Well, I have no idea. Obviously, that's the presidential prerogative, so I don't know when that's going to happen.
Okay, then. Let's then speak about your role as the co-chair of the Ministerial Advisory Committee. What exactly is it that you will be focusing on, and what do you think are some of the top priorities for you?
Okay, so because I'm joining an already, a functioning committee, which is functioning very well, is for me to look to see what are the advisories that are currently being worked at, and see where we are with those, what are the targets for finalizing those. And also remember that we actually play an advisory role. And what usually happens is that it's either the minister asks for specific advisories, or we look at the situation and we then can propose where we feel we need to advise the minister. So right now, what is obviously critical and important for everybody, earlier on somebody was talking about communication, how we are communicating with the ordinary South African citizen to actually get them to understand where the epidemic is, especially where it pertains to vaccinations, because you get a sense that people are not really clear as to what is happening, when is phase 2 coming in, and is there going to be prioritization when phase 2 kicks in. So I think it's going to be important for us to advise government as to how to articulately communicate these messages to the public. And the second bit that I really think is critical is then being very clear as to what the plan for vaccination is, so that people have a sense and they know exactly what government is planning to do. So really, I think for me, those are important, one of the key areas that we need to do over and above just emphasizing prevention, because prevention has got to be what we do every day.
Is part of the advisory strategy also looking into whether or not South Africa can build capacity to develop a vaccine? Looking at, for instance, Nigeria indicating that they've developed 2 vaccine candidates and that they're currently on trial.
Well, I think right now everybody is realizing that this is a global pandemic, and whether whoever is currently producing vaccines can actually produce enough for the world is something that we are still, struggling and trying to understand. And so I don't see anything wrong in us. In fact, I don't even think there would be need to advise government in that. We have got great scientists and researchers within the country. And in my opinion, nothing stops those researchers in exploring other vaccines, because really we are great players when it comes to research. And so I don't even think there would be need to actually advise that to government. But what also is going to be important and critical, which has already been started, is the level of manufacturing, and I think there are already engagements there that we need to make sure that as a country we are part, and we play a role where we can actually develop manufacturing plants within the country.
Do you know of any research that's currently being done to develop a vaccine locally? Not
that I know of at the moment, but we've been talking about this, and I know that Slim as well has mentioned this. And so, sometimes, you really only get to hear about research when there's something that's positive. So really, it's a matter of saying, the scientists in the country, anybody who really feels they've got a construct that they think it can contribute to vaccine vaccine development, there's really absolutely nothing stopping the researchers from doing that.
Okay, and then on the issue around the procurement of these vaccines and the conversation that's also happening at the World Trade Organization's level, and we've just heard now that the United Nations has also declared that vaccines should be made readily available and freely available to that. What else do you think South Africa can agitate towards to make sure that that is expedited?
I guess, as South Africans, we really have always been major players, and we sit around the table. And so for us, it's a matter of, pushing in and making sure that we add the emphasis on getting these vaccines made available. But obviously, as to access and how that comes and what amounts are coming into the country, that's what the Department of Health then would look into. But otherwise, it's for us to keep on pushing and making sure that we are sitting at the table in making those discussions and putting whatever pressures that need to be put where those pressures need to be put.
Is the Ministerial Advisory Committee also looking at certain manufacturers who would be able to manufacture those vaccines should the WTO be able to win the battle around the IPs?
For that one, Algin, I would say I probably need to look then and see whether there's been any work done by the MEC, insofar as that is concerned. And then as a collective, we can have a discussion and see whether we feel that actually is something that we should tackle as MEC. But for now, I am not sure whether there's been any work around those issues. And, once we've had, I've had the first meeting with the rest of the MEC, then, right now I'm busy looking at the previous minutes. And then once we have a meeting, we then can see what are some of the next critical, areas we need to look at. And if the group feels, manufacturing is the next important thing, then we will make a decision as a group.
A final one is on some of the groundbreaking research that you have been part of, and also into the mutation of the virus. Currently, where we're standing at the moment, are we seeing any further mutations of the virus?
Okay, so what we have established, as a country, is that we have got a surveillance system that's ongoing. So there is a genetic surveillance that's ongoing, and we therefore are monitoring the kinds of virus that's in circulation. And we are able, Professor Tulio de Oliveira is the one who's been leading this, and we have got a significant number of South African researchers from various universities and from various academic institutions of the NHLS who are actually doing this work and contributing almost every week of a number of samples to actually be analyzed. And so we then will hear from those that are doing the genetic analysis, should there be any, variant that seems to be emerging, and is it a variant that we should be concerned about? So basically, are there any variants coming in? We are seeing a few, but as to what they mean, we don't know yet. So remember, this is surveillance. So we have to look to see and then try and understand the characteristics of that variant before we can say it's a significant variant. So that's work ongoing.
Okay, then thank you so much for that. That is Professor Koleka Mlisana, who is the newly appointed co-chair of the Ministerial Advisory Committee on COVID-19. Appreciate your time.